gene therapy is showing promise for thousands of people in the U.S. battling sickle cell anemia. 2 years ago, a Mississippi woman named Victoria Gray started the treatment. Gray was diagnosed with sickle cell at just 3 months old. She volunteered for the new landmark treatment. It was the first attempt to use the gene editing therapy to treat the genetic disorder in the United States. Now, 2 years later, the therapy has changed her life, and doctors hope it will lead to a revolutionary change for thousands of others living with the disease. So here to talk more about that and on this new treatment, we have Dr. Haydar Frangoul, the medical director of the Pediatric Hematology and Oncology for Sarah Cannon and the Children's Hospital at TriStar Centennial. Also joining us, we have BNC's chief medical editor, Dr. Corey Hebert. Gentlemen, it's a pleasure to have you both. Dr. Frangoul, we'll start with you, sir. You're participating in what's being called a breakthrough treatment for sickle cell. Walk us through what that treatment is.
Well, first of all, thank you for having me on your network to talk about this very important clinical trial that we are doing. And sickle cell disease is very close to my heart because I've been treating children and young adults with sickle cell disease for many years. So as you know, that sickle cell disease is a debilitating disorder that can cause pain. And as patients get older, they are hospitalized more, they have organ damage. What we are trying to attempt is historically, so let's go back a little bit. Historically, for sickle cell disease, the patient's only curative option is something called a bone marrow transplant. So you have to get cells from a related relative, and only around 15% of the patients have that option. So what we are doing here is we are actually using a revolutionary a clinical trial by taking patients' own stem cells out, collecting them through the blood, and then gene editing them to make them make high levels of fetal hemoglobin to protect patients from complications of sickle cell disease. And so potentially, if this therapy shows promise, every patient have an option for treatment, not the only 15% of the patients with sickle cell disease.
Yeah, bone marrow transplants are very painful. This sounds less invasive.
Well, it is not only less invasive, is when you do a bone marrow transplant from somebody else, you have to take something called immune suppression to keep the donor immune system under control and does not attack your body. But when you are using a technology where you are using your own cells, when we put them back in, your body do not reject them and those cells do not attack you. So basically you are carrying your own cells back in that are gene modified using CRISPR-Cas9, which is a genetic tool that allows us to make specific gene alteration in the stem cells that can help the patients produce high levels of fetal hemoglobin.
Yeah. Dr. Hebert, I know that this is very near and dear to you. And we've had this conversation many of times. Sickle cell, very common among our people, more than 100,000 folks in the U.S. living with the disease. Describe what this means in terms of fighting this debilitating disease.
Well, these types of therapies are what we need to have. You know, we need to have more money so that we can do more research because as the doctor mentioned, I mean, we have talked about curing sickle cell with bone marrow transplant. And when he mentioned that these drugs that you'd have to take, you have to take them for the rest of your life to stop the graft versus host reaction. These drugs are sometimes just as dangerous and has many side effects as the sickle cell drugs themselves. So theoretically, it will be a cure, but really, you know, it's something that still doesn't allow you to have your life back. So with something like this CRISPR technology, it's basically fixing your gene so that you won't be able to have the sickle cell crises as much as you would have had it with having sickle cell. So that is something that is groundbreaking. And what we have to try to do is be able to get the price of these things down and get insurances to cover them. Because if we don't, still, it would be something that may not be in the reach of everyone. And that's what the centers are doing across the country, be able to make these types of things readily available so that we can fix this. I mean, there's 100,000 people in the United States with sickle cell, but there's 4 million people in the United States with sickle cell trait. And those people also can have debilitating disease and death from sickle cell trait. And we need to just remember, we just had Thanksgiving and Christmas. I bet nobody in their homes asked if anybody had sickle cell trait. And right now it is crime for Black people to not know their sickle cell trait status, because the 97% of all young Black women that have a baby with sickle cell disease, life-changing disease, had no idea that they had sickle cell trait, that they're part of sickle cell trait, and they just brought a baby into the world with a disease that could possibly kill them at a very young age, and that is criminal. So we're working across the country now, and I'm enlisting anybody that wants to help. Famous folks, we have young men running around the football field with pink shoes on for breast cancer. And don't get me wrong, breast cancer is a very important and serious disease. But every Black person theoretically can be affected by sickle cell disease, and I think we should kind of have some football players running around with our color shoes on to protect us too.
Yeah, I wish we had more time, so I'm going to try to squeeze in a few more questions. Dr. Frangoul, we're still in the early stages, right, of this latest treatment. Do you know how long it'll be before we could actually use this revolutionary treatment to treat other illnesses like cancer, AIDS, and other genetic afflictions?
Well, first of all, I want to say that this continues to be a clinical trial. So this therapy is not commercially available yet. We are hoping that it will be commercially available in the next year or two. We are continuing to follow the patients that we have treated, and those patients are going to continue to be followed for up to 15 years each to look and make sure that this therapy persists and continues to help patients. The early indications we have, as you mentioned earlier in your segment, shows that patients are actually benefiting and this therapy is lasting. Victoria is a great example. She did 2 years ago and she continues to thrive. And she went from having 7 hospitalizations per year before the treatment to having 0 hospitalizations after the treatment. And this is lasting at least now for 2 years. So I'm very optimistic that this therapy hopefully would last and be effective in helping many, many patients, not only in the United States, but hopefully worldwide. Like your medical correspondent mentioned, this disease is not only limited to the United States, it's a global problem.
Yeah, and speaking of that global problem, Dr. Haydar, during the commercial break, you mentioned that more folks in the Middle East suffer from sickle cell anemia than folks here. Can you briefly explain why we are more susceptible to this disease than any other group?
Yes, so basically, when you look at other countries, they don't do the sickle cell screening that we do at birth. Like everybody in the United States gets screened. But this disease originated as a protection against malaria in Africa and all of the places where people have left the African continent, sub-Saharan Africa, and going north to Sicily, going across the Middle East to Turkey. These places still have sickle cell trait. And if 2 people with sickle cell trait have a baby, then there's a 25% chance that baby could have sickle cell disease. And without having any knowledge of these things at all in the Middle East, by and large, then these people don't really know until they get very, very sick. And that's why things like this and other medicines that we're using are going to be used throughout the world, because this disease affects people in the world, not just the United States and Africa.
Yeah, and you mentioned earlier as well that you'll be heading over to the Middle East for research purposes as well. So safe travels. Thank you both for stopping by to talk with us. We really appreciate it. Such an important topic.